Hi, good
Okay.
afternoon. Namaste. This is Ira Sahai back again after a chota sa break with dLife course review videos. I have with me today, and before that, I am a dLife certified metabolic health coach, also its operations head. I have with me today Dr. Sandhya Kulkarni, who's a member and now a dLife certified metabolic health practitioner. And a bit of bio on her, a very brilliant bio, by the way. She was brought up in Satara and studied in a military school till 12th, after which she joined MBBS in Mumbai and subsequently did her MD2 from Mumbai. Dr. Sandhya has done countless diabetes related courses, literally, did diabetic foot care training at King's College in London, has a passion for learning new things, and hence did courses in various aspects of nutrition, including veganism. Having done all of these courses, she finally enrolled into the dLife Diploma course. She says, my approach towards life is practical. I found the dLife Diploma course doable by everyone. I follow this myself to the T. Recently, for my public work in diabetes awareness, I've been awarded the Best Innovation Award in Diabetes through RSSDI of New Delhi, where I talked about dLife and Anup and his immense contribution in creating the Indian LCHF revolution. This is such a brilliant bio and such brilliant work, Dr. Sandhya Kulkarni. Welcome, and let's talk about the course itself. So, first of all, congratulations for this award that you got. I mean, this is such a matter of pride for us at dLife.
Thank you. Thank you so much, Ira.
Yeah, so let's begin. I mean, you are a doctor, you're a mainstream doctor, and as you've admitted, you've done a lot of courses already on diabetes and stuff like that. Why did you
Yes.
finally enroll into the dLife Diploma course? How does it offer, and what does it offer, which is different from the other courses?
Look, mainstream medicine is predominantly guided by the pharma and the food industry, and all of us know it. Now, when we finish our MBBS, we definitely read the biochemistry and its applications in human biology. But as we specialize in different streams of medicine, that really goes somewhere in the background, and we are more focused on patients, and we are often taught to treat the symptoms very often rather than getting to the root of the cause in modern medicine. And every doctor probably does this. What I found here in dLife is I have practiced diabetes since 1999, and my approach towards diabetes was very different. I'm not a doctor who likes to, admit patients or who likes to give a long list of medicines. I like to find out why they are not improving, why they are worsening, or what wrong is going on. And then obviously I came to know about nutrition. Like, yes, there's something wrong in the day-to-day nutrition which every one of us follows blindly. Sometimes we take up coaches somewhere online and we blindly follow them. So here in dLife, I thought that I'm going back to my biochemistry first MBBS and trying to actually apply it to what happens to my patients and myself. So this course was, in a way, I would say, like in medical, we say clinical pathological correlation. So this was like a clinical and a pathological correlation for me, and I found this correlation to be very interesting, and it opened up so many things which I might have read as an MBBS student, but I have never applied. So I found this very useful. As always, I have already mentioned that I have done so many courses and I have taken so many consultations, and everything was calories in and calories out, calculate, eat by time, eat so many meals and all. And as a doctor, I was never satisfied with any of these. They did not yield results. When they did not yield results, I'm one person to have asked them as to why me, why did this not yield result, and then they try to find out so many mistakes in me. Now, when I go back and see uh, the pattern of eating, the content of eating, everything was wrong. There was nothing wrong with me. I was following them also. And then also, when I did so many courses, I found it not doable for a long time. I couldn't sustain any of them because I definitely felt hungry. And once you're hungry, you cannot focus and you eat anything that comes in front of you. That happened to me so many times. Even in the course on veganism, I did lose a lot of weight, but then it never stayed. And then I had to eat and I had to come back to my own self normal. So I found dLife as a very scientific approach, very practical, very doable, and it's the truth which we deny to follow or we like to overlook in day-to-day lives. Even doctors don't follow it or don't apply it. And it should be applied to every human being. Once you start teaching people that this is this, okay, the initial teething problems are there, denials are there, non-acceptance is there, but then if you persist over a period of time, I think we can convince everybody to do it, at least to begin, if not doing it 100%. At least start your low carb journey. Journey of 1,000 miles always begins with the first step you take. So I did it myself and it was very good for me. Well, I have been a exerciser since 2008. I'm into regular exercise. I was never able to lose weight. And when I combined this low carb with my exercise, I think today I am 10 or 12 kgs lesser than what I used to weigh. And every patient of mine or everybody who sees me after maybe a 6 month gap says, Ki, what is wrong with you? You lost so much weight. That's okay. That's one way of saying, but they also do say that I look 10 years younger. I take it that way. That's a better compliment.
Yeah,
So,
absolutely wonderful, wonderful to know this. And you would know that, as you rightly said, it's not about just the calories. I mean, at the end of the day, it's about a lot more, which this course teaches you. And effortlessly, as I always say, on LCHF, weight melts away like butter. So all of us have experienced this and, eating more and eating to satiety. And then, despite that, losing good amount of weight. Dr. Sandhya, such a brilliant journey you've had. Please tell us, for doctors to understand, for other people to understand, what happened when you started putting the principles or what you learned from the course itself onto your patients. We already know that you got great results. Are you putting that into practice when you are handling your patients, and how is it working for you?
well, I am putting it. I am in Dharwad. My population here is not so educated and not so, elite population, or they would know everything. But as I sit with them, predominantly I get a lot of villagers, but as I sit with them and I try to teach them, I think at least 2 in 10 try to apply it somewhere. At least they begin with making changes in their breakfast. And also, the community here is predominantly vegetarian. So if I say you can have eggs for breakfast, they don't want it. Plus, North Karnataka, we are not paneer eaters. Absolutely no paneer eaters here. So for vegetarian diet, it becomes difficult, but still, anything which is easy is not very accepted by people. You all know that anything which comes free has no value. So I tell them like that. Anything which is free has no value. So you have to take efforts. You have to do this. You have to bring small changes. So acceptance, yes. A problem with acceptance of my patients, because there are some patients who literally start crying if I tell them stop sugars. For the first year, stop your sugars. They start crying also, but still I persist, and every single day I will tell them how to include more protein, how to reduce your carb in your daily diet. My journey is just begun. I don't know how difficult or how good or bad it is, but then I always feel that okay, I have done it, and I tell my patients, if I have done it, if I could do it, you also could do it. Just give it a try for 3 months, 2 months, 1 month, 1 week. I encourage them by doing that, and there are a few who have definitely started. So our journey has started. Let's wait and see how they do.
I'm sure they would do wonderful under your guidance. Dr. Sandhya, tell me, I mean, recently you were awarded for your public work in diabetes. You've been given the Best Innovation Award in diabetes. Where you were one of the guest speakers there, you're one of the main speakers there, and you also talked about the contribution of dLife and Anup in the Indian low carb space. Please talk about the event and what happened there in brief, and how did it all went.
These are two events actually. The RSSDI event is RSSDI is a national as well as an international body. dLife is a very recent addition to my portfolio. I have been working in diabetes since 1999, and I have every single year I have done thousands of screening patients and telling them whatever I knew then about diabetes to try and improve their quality of life. So it has been 25 years now that I did. So in recognition of that, I got the RSSTI award, and there were only 20 people in India who were recognized for their services. So that was it. And then immediately after that, I got an opportunity to speak at a state level conference, which is not a medical conference. You know, medical doctors do not accept anything of this kind so easily because थोड़ा सा दिमाग में रहता है that we are a cut above the rest and all that. Agreed. All doctors are definitely a cut above the rest, but doctors don't know much about nutrition that doctors do not accept. Well, having said that, I was invited for a Beyond Ophthalmology session at COSCON, that is Karnataka Ophthalmology Society, where they have one section for non-ophthalmology things. And there I did speak about dLife, which is the only low-carb nutrition course in India. And I also spoke about about Anup Singh, and it was very well taken. And after that I have got so many calls to upgrade and update the doctors about nutrition, especially because even in the medical field it is very common to accept diabetes and blood pressure as one starts aging 40 50. So they say that diabetes to aana hi hai, bp to aana hi hai. So, I have received lot of requests for giving them seminars or webinars. I have received a call from a local body also to speak about low carb nutrition. So it has been very well accepted. And I think a few doctors who are well read also have started reading up on this, so slowly the awareness is definitely increasing and improving.
Yeah, I think more and more doctors, I mean, right now, 43 doctors have enrolled into the dLife Diploma course. I think more doctors need to come forward. As far as acceptance is concerned, Anup and Shishi, they organized the Global Metabolic Health Conferences from India. Two have already been organized, and the third one is going to be organized in February 2025, where we have seen 70 plus mainstream doctors working with low carb as far as chronic diseases are concerned, even for cancers and mental health. So probably it'll be great if you can or probably doctors can check out those links on the YouTube channel. We've already done that. As I said, 43 doctors are already part of the course. So I think together we should be working as metabolic health practitioners to work on the metabolic health crisis of India and the world at large. I mean, that's a big force, if we can join hands together. Dr.
Definitely.
Sandhya, yeah, Dr. Sandhya, tell us, how do you find the dLife community itself? I mean, you have access to you're part of the WhatsApp community, you're part of the forum, you have access to the recipes, you have access to the podcast, to case discussions, the older threads where cases were handled, and all of that. I mean, usually when you enter a course, it's just the course, and once you're done, you get certified and you leave. I mean, that's how
True.
it is.
Yeah.
So, how do you find this entire ethos of dLife where you remain a member for life and it's like more like a family, as I always say?
So this part of dLife is the most fascinating and most exciting according to me, because it's like you get the first hand experiences of how your colleagues in dLife have handled the case. And me being doctor, it's probably more easier for me to understand the reading material which is there on the forum is extensive. And I guess Shashi ji, he keeps on updating and putting new articles every single day, and people are very helpful, and you remain a lifelong member of a certain community which is ready to help you whenever required. That's the best part of it, because every course you do have for the duration of course you have your professors or you have colleagues helping you out, but once you're done with the course you find it very difficult to connect with them also. forget them telling you something or giving you guidance. So this is the best part of the community, and since it is ongoing, it's being upgraded every now and then. And with these metabolic health conferences every year, I had a link last year and I have attended. This year I look forward to telling more of my friends to at least log in and see what's happening so that they can also join in and understand. So I like this as the best part of dLife, where everybody is helpful. It's like a big family helping each other. What more can you ask?
Yeah. Very well put there, Dr. Sandhya. As a last question, maybe, what would your advice be to other doctors? People who are practicing, in similar fields like yours. As I said, I mentioned 43 are currently enrolled into the dLife diploma course. What would your advice be to them? Why should they enroll into the dLife diploma course?
See, I can't say about other branches, but I can say definitely about my branch, general medicine. I think every physician should know in depth about nutrition, and with India being the diabetes capital of the world, knowing nutrition, knowing nutrition rightly through day life is the best way. You know it for life. Once you know it for life, and you get lifelong health. That way, you are always able to treat your patients better, maybe reverse diabetes in so many patients, prevent them from going into complications because diabetes, hypertension, fatty liver, obesity, so much is there, not only in adults, even in kids. First, we used to think it's only in the urban population. My population is rural. We see it day in and day out there, and the eating principles are wrong. The way the people eat, celebrate itself is wrong. So if a doctor knows what to eat, how much to eat, how to eat, when, why, and tells that to the patients, it's like coming from the horse's mouth. At least patients will follow something about it, or if they hear it once, they would like to hear it once again to confirm. And thereby, by doing these basics, we can really improve our society, economics, health economics, food economics, everything. So I feel every doctor, every physician, or everyone who sees diabetes in their clinics must do this course and must apply it to their patients.
Very well said and very well summarized. Just a little bit of brief on the course itself. We are the largest content on low carb nutrition and metabolic health course in the world. We have 800 references in the course, 200,000 plus words, 60 plus relevant videos. There's lifetime access to the course. 6 months additional access to the forum from the start of internship. There is no recertification clause. New content is being added to the course, which will be even bigger. We are now the number one rated course in the world, CPDSO UK accredited, with 60 credits. And now, it will be even bigger for us. We are India's only legally tenable course. As I said, CPDSO UK accredited. We are also the SMHP approved CMHP provider. Course gives free access to dLife.in forum platform, which is 10 plus years of premium curated data, which is subscription based but given free and complimentary to all course enrollees. On the forum, you will find 5,000 plus combined success stories of remission of various metabolic disorders, 2,000 plus original low carb recipes, keto recipes, vegetarian, non vegetarian, both, 200 plus podcasts. We have the largest content on low carb nutrition and metabolic health, as I said. We have one of the biggest libraries of low carb resource materials. We have a robust forum of discussion and long threads on cases, and a 24/7 WhatsApp community support where we have a lot of bonding, fun, and discussion, of which Dr. Sandhya and I both are a part. So this is a bit about the dLife Diploma course. Also, it's a very proud moment, Dr. Sandhya, as you also must be knowing that our colleague and our member Mandar has just released his first book, and I have a copy of this here, and it has been very well received. This is called Adunik Bhasmasur. And if you've not checked it out, I mean, Mandar has posted it everywhere. We have posted it everywhere. It is about the first principles thinking of tackling chronic diseases at the root cause. It is in Marathi. It gives a step by step logical, practical guidance and ends with the emerging big global picture of metabolic health. Does not use anecdotes, weight of authority, guidelines, any particular pethy, any religion, cultural argument, but arguments purely based on science. It's a fabulous book. It was also showcased in the recent book festival or book mela in Pune. And if you want to grab a copy of these, those who are watching it, it's a must-have book. Please go to Amazon and type the name of the book, and you will get the buying link. Very proud of you, Mandar. All of us at dLife are very proud of you. Dr. Sandhya Kulkarni, thank you so much for joining, and we are very proud of you as well, what you're achieving, and very proud to call you a family member of dLife. Thank you so much for coming and for speaking with us. Yeah, you've given great insights, not only to lay people out there, to laymen out there, but also to doctors who are interested in studying nutrition, who are interested in remission, who want to do, who are wanting to work for the benefit of the patients. I think you are such an inspiration. Thank you so much for coming and speaking to us.
Thank you. Thank you so much.
This is Ira Sahai signing off. I'll be back again with another dLife Diploma course to do with you. Stay tuned. Goodbye.